Welcome back to Good Morning San Diego. 70-year-old Douglas Badger is described as one of San Diego's most violent sex offenders, and he is slated to be released this Friday despite protest. Joining us this morning to talk about it is a forensic clinical psychologist and professor from Alliant International University, Dr. Glenn Lipson. Doctor, thank you so much for being here today. So like I just mentioned, a judge found that 70-year-old Badger will be released into the community, obviously causing a lot of controversy. People are not happy about this. Just break it all down for us, and why did it get to this point?
Well, if you are convicted as a sexually violent predator, hard thing to talk about in the morning. One of the, you go through a process of getting evaluated, then there could be a hearing, and then there's a ruling depending on whether or not you could be released. So what's looked at is what is the danger you potentially pose to the community. Someone, once they do their time for the crime, they have the potential to be released. The sexually violent predator laws are more about a civil commitment to protect the community, and the court, and through this process of adjudication, they decided he's no longer dangerous and can be released.
Now, the public can comment on the proposals Friday in court, at a court hearing. What do they need to know? What should they know in order to make a fair decision?
Well, the public needs to know a number of different things. Number one, this is someone whose crime started in 1974.
Right.
He claims over 20 of them, mostly young men kidnapped 18 to 29 in vehicles with firearms. In addition, there was one girl about 16 years of age. That frightens us because now you have a woman and men.
Right.
However, he's 70, and so what we look at something called risk management and prevention. What do you need to prevent someone? Maybe take away the car if all the crimes are done with the car. Make sure there's no firearms. Third, there was an accomplice involved in most of those crimes. Make sure that accomplice isn't together. So we look at risk management when someone's going to be released in terms of how do we monitor them, how do we set it up, what's going to be done to assure the community that they'll be safe. And in addition, we want to make sure someone released is safe. We don't want someone to harm them to protect their family. Now,
is this for sure that he will be released on Friday? Is this definite?
Well, there could be a number of things that happen that result in detention. There could be no place to send him, which may mean that he's kept longer. So these things are going to be sorted through in the court. And Judge Gill is a wonderful fellow on the bench, very knowledgeable, and he'll take all these things into consideration.
Okay, and if he is released, he will be essentially under house arrest, right, with a GPS tracking device. What is that all about?
House arrest means the crimes were committed before with a car. He won't have access to a car. When you're released, they then have the right to search where you're living, so they'll make sure he doesn't have a gun or the weapon that he used to coerce and sexually assault people. GPS means if he steps out of that residence, and the device is attached to, let's say, his leg, if he steps out, then an alarm will go off. So these are different things they put in place to manage the risk.
So he'll have to have someone cater to his needs, to bring him food, to bring him water, if he's not allowed to leave the premise, right?
Correct. And then you need to look at how the order is written. Maybe he'll have the food delivered.
Okay.
So you have to see what's happening. Maybe there'll be someone who's approved to take him for a ride when he's under supervision. So you need to look at how this is actually set up.
Now, bringing our viewers up to speed, you mentioned this dated back to 1974. He was convicted in '81. He served 10 years, was released. Then in '91, he was arrested again. But he went to jail just for a little bit, but then he went to a hospital. So how do they determine where to take him and at what point, at what level?
Okay, so they're looking at this fellow as a criminal. He has a diagnosis of either schizophrenia or schizoaffective disorder, which means they felt that mental illness was contributing to what he was doing, so there was some treatment, but not to the degree that he was found not guilty by reason of insanity. So there has been some mental health treatment. So he has a number of factors that make him more frightening. Mental illness, he's used weapons, he's been more versatile in terms of victims. So those are things that get looked at. Very often when someone is evaluated, they could look different in a hospital or in a prison where there's the structure than when they're released to a community. So that's a step that we worry about, and that's why we have to engage in prevention and risk management to protect both this man and the public.
So they've called him schizoaffective. What is that exactly? How does that compare to schizophrenia?
Well, schizophrenic means it's a psychotic disorder. You could hear voices, you could hallucinate. They're those typical symptoms. Affective means you also have depression and mood swings. So you have both those combined together, and it's a diagnosis that is more confusing because you don't know whether to put emphasis on the emotional, the affective piece, or whether on the thought disorder. Now, what we do have to remember with risk management is still 93% of children who are abused by either family members, that's about 43%, the rest by people they know. So he's in that small population that's abused strangers, and he's done it habitually or repeatedly. That's what makes the community and everyone much more frightened about him, and why we need much more active risk management.
It is a scary situation. Dr. Lipson, thank you so much for being here. Appreciate your time this morning.
Thank you very much.
All right, let's